Продовжуємо роботу.
We continue our work in Ukraine Crisis Media Center. Now we will be talking about the start of new program on against hepatitis. U.S. Embassy in Ukraine, USAID and Ministry of Health Care of Ukraine present key activities. Our guests are Oleksandr Linchevskyi, Deputy Minister of Health of Ukraine, Acting Deputy Chief of Mission at the U.S. Embassy, Dr. Thembi, Xulu, Chief of Party Whip, Professor Natalia Nizova, Director of the Public Health Center, Oleksiy Bobryk, Technical Advisor on HIV, TB, and viral hepatitis. We are giving the floor to Mr. Oleksandr Linchevskyi. Dear guests and colleagues, this is not a hepatitis day, this is the anniversary, one century of hepatitis day. Not so long ago, I learned by methodological guidelines and textbooks where only 2 types of hepatitis were mentioned. Now we know that there are more types of hepatitis. Not so long ago, I had in my hands the textbooks where hepatitis was named as the fatal disease which could not be cured. And now this is not the hepatitis day, this is 100th anniversary of hepatitis. We know much more, we can detect much more, and we can help much more. This is the main thing. We are very thankful on the part of the ministry because despite our efforts and funding and programs to help HCV patients, we are very thankful to our international partners for their assistance, and we hope for our fruitful cooperation to assist patients in state-of-the-art, novel manner as it should be in 21st century. Thank you for your speech. We are giving the floor to Mrs. Acting Deputy Chief of Mission at the U.S. Embassy.
Dr. Nizova, Dr. Xulu, here to mark World Hepatitis Day. This is an opportunity to recognize the efforts underway globally, as well as in Ukraine, to fight these viral diseases of the liver, which are a leading cause of death worldwide. This is a shared challenge. Hepatitis C deserves special attention as infection rates rise dramatically around the world, including in Ukraine. And there were more deaths in the United States last year resulting from hepatitis C than there was from HIV. The virus affects approximately about 2 million Ukrainians, which is 5% of the population, and most don't have access to treatment. In the last few years, new drugs have become available that attack this disease in new ways, transforming the world of hepatitis C treatment. And it allows for countries to begin to plan for eliminating the disease by 2030, a goal which Ukraine, the United States, and more than 190 countries adopted last year under WHO leadership. These drugs are not only curing more than 90% of the patients, but they're also doing it with far fewer side effects than old treatments. And USAID works intensely with partners globally to bring this highly effective combination of drugs to Ukraine. The government of Ukraine and USAID are partnering together with EQUIP Consortium for an important demonstration project that's going to begin disseminating these new drugs in Ukraine. And the project will treat 4,000 patients, and maybe even more importantly, it will inform everyone about what the costs might be and how to scale it up so that this treatment can become available and be set up across the country. I'm so pleased to see the new Ukrainian Center of Public Health work and the National Institutes and international partners bring these advancements in medical sciences to the practice of medicine in Ukraine. Similar partnerships, I mean, partnership is the key word here. Partnerships are the key to addressing other major public health issues Ukraine faces, such as HIV and tuberculosis epidemics, as well as burdens posed by non-communicable diseases. I want to commend the efforts of EQIP, Gilead, and the government of Ukraine in taking this important step to bring life-saving treatment closer to and more accessible for those who need it. I also want to commend Acting Minister of Health Suprun and Prime Minister Groysman for continuing to push for health reform. Today, Ukrainians are closer than ever to accessing modern health care, and the United States remains firmly committed to continuing to help Ukraine modernize and improve its health system. Thanks.
Honored guests from the Ministry of Health of Ukraine, the Embassy of the United States, USAID, the World Health Organization, the Public Health Center, colleagues, our implementing partners, members of the media, and fellow health advocates. Good afternoon. I am Dr. Thembi Xulu, and I'm the Chief of Party for the EQUIP program. It is indeed a privilege and an honor to be welcomed to your beautiful country on this World Hepatitis Day, where we are committed to join forces in the fight against hepatitis C and ultimately against the HIV pandemic. There is an African proverb that says, if you want to go fast, go alone, but if you want to go far, go together. As individual ministries and organizations, we cannot end epidemics in isolation. We will only be successful if we strongly embrace partnerships with governments, community partners, non-governmental organizations, human rights, and key populations representatives and networks. Funded by USAID, EQUIP supports the rapid scale-up of HIV and hepatitis C treatment across Africa, the Caribbean, Eastern Europe, and Southeast Asia. In Ukraine, we are partnering with the Ministry of Health, the Public Health Center, Alliance for Public Health, and Network 100% Live to implement a hepatitis C demonstration project which aims to test and treat up to 4,000 patients throughout the country. For several years now, Ukraine has received funding from the Global Fund and other international donors for the treatment of hepatitis C. For example, since 2015, there has been a direct-acting antiviral treatment program in this country for vulnerable groups implemented by Alliance for Public Health. As of June 2017, there are more than 1,700 patients who receive hepatitis C treatment through Alliance with a 94% cure rate. This program clearly demonstrates the effectiveness of hepatitis C treatment. But 1,700 patients are simply not enough against the WHO context of estimating that in Ukraine alone, 5% of the population is infected with hepatitis C. And in absolute numbers, as has been mentioned, this is more than 2 million people. There is commended political will, international donor commitment, and the willingness of all partners in Ukraine to join hands to walk this road towards hepatitis elimination together. It is therefore my honor today to launch the EQUIP Hepatitis C demonstration project with the support of USAID. This project will specifically be integrated with HIV testing and HIV treatment initiation and will involve up to 4,000 patients in all the regions of Ukraine. The project will have the following objectives. 1, will implement simplified testing and treatment strategies for hepatitis C infected individuals using a fixed-dose combination of DAA, ledeposivar, and sofosbuvir. Number 2, will analyze the cost outcomes of simplified hepatitis C screening and the cost per successfully treated patient, not only for hepatitis C monoinfection, but also for hepatitis C, HIV co-infected patients. And thirdly, we'll evaluate a simplified testing and treatment strategy for hepatitis C, HIV co-infected individuals. It is important to again emphasize that the hepatitis C treatment within the EQUIP project will be provided with a highly effective DAA agent called Havoni. Havoni has demonstrated high cure rates with much less side effects compared to the previous standard of treatment for hepatitis C in Ukraine. This project will be used as a stepping stone to ensure that such highly effective drugs will eventually be made available for all Ukrainian people within the public sector program. I would like to go back, as I end, to the African proverb that I quoted earlier. Without a doubt, the greatest achievement of EQUIP thus far has been our strong relationships with local stakeholders. Working together, we have been able to develop creative solutions that are appropriately responsive to the local needs, thus assisting countries to reach sustainable responses to HIV and hepatitis C. We are all citizens of one globalized world, which simply means that we are bound together by our humanity. How we react to diseases like the silent killer called hepatitis C depends in part on whether we understand this interdependence. It is not someone else's problem. It is all our problem. Let us therefore all join hands responsibly today as a sign of our humanity and fully recommit ourselves wholeheartedly to our journey to see a hepatitis-free generation during our lifetime. So with your permission, as our partners, I would like to end by saying, by working together, we can now say that even though we have just started, the race towards elimination is on in Ukraine. Catch us if you can. Дякую.
Thank you. Передаємо слово Наталії Нізовій, директору Центру громадського здоров'я.
The floor is given to our next colleagues. So we have a wonderful event today. And as Oleksandr said, Ukraine now joins the countries that provide access to treatment to their patients. This event is also important because for the first time we can be optimistic about real prospects to overcome challenges of hepatitis, because the Ministry of Health and the institutions, they build the system of provision of help based on a patient-oriented approach. They provide help to groups, vulnerable groups, and there is an administrative reform, and they clearly understand that the main priority for the country is the health of the citizens. In the framework of the association with the EU, the development of healthcare means that we should overcome and eradicate such diseases as hepatitis, and we have good examples how to build proper system of response, and there should be proper treatment of TB and HIV, and we understand that now we need to build the component how to counteract hepatitis. And also we have optimism. As my colleague said, we move together. This is a very good news. And Ukraine on this way is not alone. I would like to thank again our friends from the agency of USAID and the World Health Organization, Euro Commission, for their efforts, for their work with the representatives of the pharmaceutical business, and it provides us the opportunity to register and use in Ukraine quality generics. The prices are several times less than we had several years ago. So for the same money, we can treat tens we can treat more patients. So we know fantastic figures our patients mentioned through our hotline, and we believe that this will be left behind. So we have great hopes, and we have coordinated efforts together with our partners with EQUIP project in order to introduce the model of care and to provide this transition period from pilot project to sustainable services. And we hope for the quick implementation of this project, and we hope that we will soon be able to say that any patient will be provided with proper treatment, and until 2020 we want to reach this goal. And also concerning hepatitis, the same, not only B and C hepatitis. So we believe in our success, and thank you very much for cooperation.
Bobryku.
Dear colleagues, friends, last year WHO adopted a very ambitious plan to eliminate hepatitis virus. This plan was possible because we have now 2 very efficient drugs against 2 main types of hepatitis, for which 96% of fatal cases fall. We have very efficient vaccine against hepatitis B, and for the first time in this history in recent years, we have highly efficient drugs which are low toxic these days against hepatitis C. So we hope that they will eliminate this problem to the highest extent in Ukraine. And the Ministry of Health of Ukraine addresses this challenge very strongly, and the joint mission of WHO and the American System of Control of Diseases visited Ukraine, and they assessed the situation in Ukraine. We got access to all institutions and all knowledge, and the report will be issued in the end of September, and then the plan of elimination of virus hepatitis in Ukraine will be created for Ukraine, and we hope that Ukraine will become the best practice example for other countries as well. Now, thank you very much, and the round of questions and answers will start in. Good afternoon, Olga Korpriyanova, portal Zdorov.info. How can patients take part in the program? Where they should go, who they should address? As our colleague says, this program is performed via charitable International Alliance for Health as private sector NGO, and also Ministry of Health on the part of government, and also Public Health Center. Every organization appointed its coordinator. I am a coordinator on the part of Public Health Center. There is special feature of this pilot project. Taking into account the approach of public health, we engage first 800 patients with double, triple pathologies such as also TB and HIV, along with HVC infections. In the second group, on the second stage, we will address wide the category of patients, and looking into the first stage of several months of our project, we will look how can we widen the access of patients to treatment. In parallel with this project, we continue intensive activity possibilities of additional, beyond the limits of this project, accessibility in Ukraine of state-of-the-art drugs such as Sapazvavir and Harmony, because this work means negotiations with pharmaceutical businesses, and we have very good results upon negotiations with them. Lyudmila Pavlenko of TV channel, I have the question to the Ministry of Health representative. Could you comment how many people in Ukraine are diagnosed hepatitis C patients, and are there your calculations available? We know calculations of WHO. We know that testing for HCV is on paid basis, not free of charge. Unfortunately, the number of patients so far, according to WHO, we rely on WHO counting, and we detect, this is our task, to detect those who has not been detected yet. Out of those who are detected, we understand that this figure is underestimated. That is why this project is so relevant. Now we can talk about a portion in dozens millions hryvnias for combating hepatitis. But anyway, we will need international organizations' assistance, despite of this funding from the Ukrainian government. We can rely now on these underestimated counts, but we should understand that the problem is global. Analyze this channel, look at it fairly, and say that in fact we have far larger numbers of hepatitis in Ukraine. And we should control it and try to eliminate it via real help, real assistance to real patients. Of course, this money will not, this assistance will not be enough to cover all the patients. Specify, please, what amount is allocated in Ukraine for combating hepatitis, for controlling hepatitis. As far as I remember, 92 million hryvnias are allocated. But anyway, we should look into the figures. I don't remember for sure. Objectively, we can provide you detailed information in follow-up. I have a question to our foreign guests. Can you comment what is the amount of funding, what is the period of the program, and is it true that 8,000 people more will receive treatment?
At present, we have the project covering 4,000 patients all over Ukraine. The funding that we currently have is up until 2019, but there is obviously ongoing discussion about extending that beyond 2019. There has been commitment from USAID, specifically in Ukraine, to buy into this project, to take it further. So for all intents and purposes, we are hoping that as the ministry buys into the results and the outcomes and the costs of this project, we'll be able to get to more patients by working together.
Будь ласка, наступне запитання.
Дар'я Трапезнікова, газета «День». У мене запитання, власне, по цьому проєкту.
Дар'я Трапезнікова, I have a question. What will be the base, the venue of this project? Will this be hospitals, state hospitals? Will patients pay for the drugs? Thank you for your question. The project will be conducted in 5 regions of Ukraine, in the cities and where HIV and the HCV epidemics are most wide, and where the most of patients, the majority of patients has been already detected. So, we detected 50,000 cases of hepatitis last year in those regions: Odessa, Dnipropetrovsk, Zaporizhzhia, Kiev. and Donetsk and Lugansk regions. And taking into consideration the highest burden in those regions, the initiative group which will be implementing the project, Ukrainian partners and the American partners have already assessed the hospitals, state medical institutions where this treatment will be organized. The assessment was very detailed. The capacities, the staff were assessed, the opportunity to provide tests, first for fast diagnosis and also for verification. And these institutions in July are already ready to start. In 1 week, the drugs are already in Ukraine. They will be transported to these medical institutions. Treatment will be free of charge for patients. Everything, all services will be free of charge for those patients who will be covered by the project. And the last question, the TV channel Kiev, the question about vaccination against hepatitis B. As the Ministry of Health representative, can you tell us about this and how much money is allocated? Yes, today the program of prevention of infectious diseases is available in Ukraine. Component of vaccination is very acute. Ukraine has more than 600,000 vaccines against hepatitis B in Ukraine. This is 100% of coverage. The new program is being developed on prevention of and treatment of hepatitis, not only C but also B and A, and the spectrum of hepatitis is far wider than only type B and C. And Ukraine is preparing this hepatitis prevention program. Ukraine looks forward also in the scope of association agreement with the EU and our agreements with WHO and USAID. We look into the possibility to prepare integrated programs, not on one disease but on several diseases and integrated programs. Ukraine leads in such issues. No country in Eastern Europe and Southeast Asia has made such steps as Ukraine. We have approved fast-track program according to the Paris Declaration. Kiev was the first city. Mr. Klitschko, mayor of Kiev, has signed this. Then Odessa mayors signed this program fast track, and we also support the initiative of multi-resistant TB prevention and treatment. And now this is the third step inside the integrated program which is being developed by Ukrainian Ministry of Health, and it will be in line with all European and world trends in public health care, because the problem of vaccine preventable diseases is the most sore challenge. President of France, Mr. Macron, recently stated that he will not allow to visit any unvaccinated people to enter his country. So Ukraine sets the goal to provide 100% coverage with vaccines for the population of Ukraine. Thank you very much to all guests for your participation in this event, and we hope that very soon we will know the real number of patients and have the program how to help all these patients. Thank you very much for your attendance.